everybody, welcome back to Captain Jasper. Sorry I haven't been uploading very much. I've been having a bit of health issues with migraines and kind of vision problems. I'm not entirely sure what's going on just yet. I'm still waiting for some results and some appointments. But as soon as I know what's going on, I'll let you all know. And thank you for being so patient. Today I'm going to be showing you how to health check a rabbit and what you're looking for. For anyone new to our channel, I'm Laura. I have a BSc in Animal Behaviour and Welfare and also a diploma in Animal Management. Along with studying animals, I also have worked with vets and in animal rescues, where I learned a lot of the techniques of health checking animals. Health checking any animal is so important, and I like to do this daily, as it really helps you notice even the slightest changes. And if you incorporate this into their daily routine, it becomes less stressful. Many zoos will train especially their large and dangerous animals to stand in certain spots, lift paws, or even open their mouth on command when having a health check. So I thought, why can't the same training be applied to smaller animals to reduce the stress, as repeated stress can have a really detrimental effect on any animal's immune system. Some zoos even train their animals to take medication orally or even have injections. This can be done for rabbits by getting them used to syringes, by coating the tip in something tasty like banana and letting them lick it off. Next time, fill the syringe with a bit of water and coat the tip in some banana or something tasty, and when your bunny is licking it off, just squirt it into their mouth so they get used to the sensation and the syringe. This isn't something I would do daily, but maybe once a month or something, just in case they ever need to take medication orally. Then they'll be used to the sensation of water going into their mouth, but unfortunately they won't be used to the taste of medicine. So how do you health check a bunny? Well, first of all, you need to know what you're looking for. A healthy bunny should have bright eyes, shiny coat, a good body condition score, move around well, and all their vitals should be normal. So when health checking any animal, I start with the head and move down to their bottom area. I like to give the bunnies something yummy and tasty to chew on while I'm doing it, so it decreases the stress. But generally what I'm looking for with their eyes is that they're nice and bright and clear. They have no discharge or any crust around them. You have beautiful eyes, you do. You do. Yes, and then we look at your ears. So with locks, you have to lift them up to have a look in. And again, you're just looking, I know you don't like your ears touched. You're just looking for any kind of crustiness or anything like that. And again, with their nose, you're looking for any discharge or anything like that that's coming out that would indicate something is going on with your bunny. But Alice has nice bright eyes, clean ears and a clean nose, so I'd say he's very healthy at the minute. If during your examination you find anything not quite right, so like any kind of debris coming from their eyes, ears or nose, then take them to the vet as soon as possible to find out the cause. And then you're also looking at their coat condition, so he's molting at the minute, so he has quite a lot of fur coming off. I haven't brushed him yet this morning. But that's quite normal for the time of year and the central heating that we have on. But then the next thing I will look at is their body condition score, so basically how much they weigh. I don't have scales here at the minute, but last time I got them checked at the vets, Alice was just under 2.5 kilograms, which is actually a bit underweight for his breed of rabbit. But we think that was because of his head tilt, so he is slowly gaining the weight back that he lost when he was ill. So to check their body condition score, if you do not have any scales at home, you can simply run your hands down their body. And what you're feeling for is their shoulder blades to be slightly on display and also their spine to be slightly on display, not too much. If they are very pronounced, then you have an underweight rabbit. You also should be able to feel their hip bones right here, just slightly, not too much. If you can't feel any signs of their shoulder blades, spine or hip bones, you have an overweight rabbit. So another thing I just like to feel for is any knots in their fur. I'll brush him later and give him a proper brush. Gosh, you've got a lot of fluff coming out. Any kind of debris in the fur or anything like that, I will check his nails as well. Make sure that they're all clean and nicely trimmed. And then lastly, I will check their bum. Give me a baby, it's okay. So this is an area that rabbits really don't like having checked, but it's very important because of something called fly strike. So flies will often lay eggs in a rabbit's rear end and the maggots will eat their way out, and it's a very painful way for your rabbit to die. So if you notice any signs of fly strike, then please get your rabbit to a vet as soon as possible. So with the bum area, just looking for a nice clean bum, no stuck poops or feces at the bottom, and no urine staining. The camera I was using died, so basically what you're looking for is any stuck feces or urine, and you want to keep it nice and clean. I also use something called Fly Strike, which really helps keep the flies away, which I spray on every 4 months. There's so much fur coming off of him. It's because we've been turning the heat up, so he has been losing his winter coat. So another thing I talked about was checking their vitals, which is something really the vets will do for you, but you can check things like their heart rate by putting your fingers in their inner thigh, and you can feel a pulse, but also you can feel it through their chest as well. And rabbits have a resting heart rate of 120 to 180 beats per minute. How you can test for this is simply by checking their pulse, counting the beats for 15 seconds, and then multiplying it by 4 to get their resting heart rate. But that is something I wouldn't do every day. I would just do it if I thought there was something wrong with them. So I hope you guys like this quick little video, and again I'm sorry for not being able to post as much as I'd like to. Hopefully when I'm feeling better I'll be back to posting every week. Don't forget to like and subscribe, and we'll see you next time.